I am honored to be President Biden's nominee to serve as the Assistant Secretary for Health at the Department of Health and Human Services. If I am fortunate enough to be confirmed, I look forward to working with Secretary-designee Becerra, Dr. Murthy, and with each of you in service to our country. At its core, my career has been about helping people live healthy lives. As the Assistant Secretary for Health, I would be committed each day to helping the people of our nation and improving our public health. I am both humbled by the opportunity and ready for the job. As you know well, we each come to public service in our own unique way. In my case, I was a physician for many years, specializing in pediatrics and adolescent medicine, and managing educational and departmental responsibilities at a major academic hospital system. Throughout my medical career, I have been particularly invested in health issues that are at the intersection of physical and behavioral health, and I brought that expertise to public health in addressing substance use disorders. After receiving my education at Harvard College and the Tulane University School of Medicine, I trained at the Mount Sinai Medical Center in New York City. I practiced pediatrics and adolescent medicine at Mount Sinai and Lenox Hill hospitals. Then I moved to Pennsylvania and worked at the Penn State College of Medicine and the Penn State Hershey Medical Center. At Penn State, I initiated a division of adolescent medicine for the care of complex teens with medical and psychological problems. And in addition, I started the Penn State Hershey Eating Disorders Program, which offers multidisciplinary treatment for children, adolescents, and adults with eating disorders. When I left Penn State Hershey in 2015, I was professor of pediatrics and psychiatry, vice chair of pediatrics for clinical affairs, and the chief of the Division of Adolescent Medicine and Eating Disorders. In 2015, I was named by Governor Tom Wolf to be the Physician General for the Commonwealth of Pennsylvania and confirmed unanimously to the post by the State Senate. I was confirmed twice more on a bipartisan basis to be Secretary of Health. In both roles, I concentrated on addressing the opioid misuse and overdose crisis in our state, working in partnership with the Federal Department of Health and Human Services on these efforts. We focused on opioid stewardship, meaning the safe, appropriate, and responsible prescribing of opioids. We taught those practices to medical students. In addition, we developed continuing medical education programs. We established prescribing guidelines, as well as a robust prescription drug monitoring program as part of our efforts. One of my most significant accomplishments as Physician General was signing the first ever statewide standing order for the distribution of the life-saving medicine naloxone. This enabled emergency medical personnel to carry naloxone to reverse overdoses, as well as the public to readily access the medication, saving thousands of lives as a result. As Secretary of Health through the Pennsylvania Rural Health Model, we work to save rural hospitals by transitioning them from fee-for-service to global budget payments. This model aligned incentives for providers to deliver value-based care and for rural hospitals to transform their care to better meet community health needs. In addition, we established a maternal mortality review committee to better understand and respond to the causes of maternal deaths, and we work to improve childhood immunization rates as well as other priorities. Of course, our focus changed dramatically last year, and COVID-19 became my most urgent and primary focus. We concentrated on three key priorities to combat COVID-19: containment, with expansion of testing and contact tracing; mitigation, with masks and social distancing; and medical countermeasures, such as the distribution of medications, such as monoclonal antibodies, and of course, authorized vaccines. As part of these efforts, we created a health equity task force, which included many community stakeholders, such as the Pittsburgh-based Black Coalition Against COVID-19 and the Latino Connection. We also launched a faith-based testing strategy where people could get tested at their places of worship. There is still so much more to do. If confirmed, I will continue focusing on these issues at HHS to work to get the pandemic under control. I look forward to driving efforts and oversight within the Office of the Assistant Secretary for Health that will bolster the health of our nation. I look forward to your consideration, and I humbly ask for your support. And I look forward to your questions.
Thank you very much.